Okay, so this is going to be a technique to release the internal hip rotators. So this applies especially with females, particularly female runners and cyclists. I spend a lot of time dealing with those types of athletes. So anytime you measure prone external hip rotation and you find that one side is significantly less than the other, or both are restricted, then you want to release these muscles and then stretch them. So I'm going to show a treatment on the right side. You have to use your data. So for example, if the right prone external hip rotation was 43 degrees and the left was only 37 degrees, you'd want to do this more on the left than the right, because the left side would be the side you were trying to really influence. But in principle, this is done on whichever side has restricted prone external hip rotation. Alright, so I'm going to abbreviate some of this, but basically the first thing to do is just kind of warm the tissue up, and specifically the muscles of interest are going to be the TFL and then the anterior fibers of glute medius, which run from the greater trochanter here upwards and medially to the outside of the ASIS, kind of in a line through here, and then TFL comes from the outside of the ASIS down this way, and then it merges with the IT band. But it's basically all this stuff here. Put your hands on in your pockets like that, with the heel of the hand just below the ASIS. That's basically the area we're touching. So we just kind of warm it up with some fairly generic stuff to begin with. And then I do the same thing on the left side. I'm not going to do that for the sake of brevity. Then I'd come back, and now I'd start to get in here a little deeper. So first of all, I can use two thumbs. You can see he's wincing a little bit already. And there's some champion lumps in here. I haven't even really got to my target area yet either. So the greater trochanter is right here. So it's really from there to there and there up this area here I'm interested in. It's going to be hard to see. Once you know where the landmarks are, it's not too bad. So I'm making slow, fairly penetrating strokes from the greater trochanter up and going at different angles like that. Then I would do that on the left side and then come back over here. Now I'm going to do the same thing, but I'm going to go in the other direction. And actually a good way to do this, just, that's okay, just put your, there you go. A good way to do this is just get the forearm on here. And the ASIS is right here, so I'm starting as close as I can to the, you can actually see the bone of the ASIS right there. So I'm starting just underneath it and then going down. Just nice, smooth, slow strokes. Make sure you get some right down the side as well. And these will take you over the greater trochanter. Be aware that if someone is so irritated there that they have a bursitis, a trochanteric bursitis, then I would avoid that area. Let pain be your guide for that. Okay, then I would do the same thing on this side. Then I'd come back over here. And basically more of the same. And for the first treatment or two, that might be all you can do. Just obviously in real time, spending a little more time than I am, and being a little slower and deeper as the tissue warmed up. Now let's assume that we've got most of the surface lumps out. Now we want to really get specific. What we do now is we start with leg and medial rotation like this. I'm going to get to the greater trochanter, which is right here, right there. ASIS is here, and I'm going to run a line from the greater trochanter up to the ASIS. And as I do that, Mike's going to turn his leg into external rotation, so it's kind of like an active release type of stroke. So just nice and slowly turn your leg into external rotation. And relax. Go back into medial rotation, and again go ahead. Can you hold that like that there? That would be good. Okay, that's right up. There you go. Go into medial rotation. Go ahead. So these strokes are not very long. I'm only doing about 1 inch to 2 inches. when I do this, and you can't do a whole bunch of these in a row because it's just too painful. Go in, again, that's it. But that's basically the principle. And then to stretch it, you can do the supine stretch, which, make sure there's enough space. Right, bend your left knee. Here. Right, so I'm here, I'm going to pull the right leg towards me, push the left knee away from me. And note, I'm not below the malleolus. You'll put a lot of stress and unnecessary stretch on the ligaments and peroneals on the outside of the ankle. Take a big breath in, Mike. Hold the breath, pull the right leg out to the right. Good, hold. 1, 2, 3, 4. Exhale. And then just gently, I pull the right leg into a little more hip adduction. Where do you feel that stretching? Yeah, so always check that it's stretching in the area you intend. And you need to do at least 2 or 3 post-isometric releases like this in a row. So let's do one more. Go ahead and pull out, hold. 1, 2, 3, 4. Relax. So he's trying to abduct his right leg for 5 or 6 seconds. And then when he breathes out and releases the tension, I gently pull the leg into adduction, which increases the stretch on the abductors on the outside of the right hip. And you could do 2 or 3 or 4 more of these, and then after the last one, hold the stretch for at least 20 to 30 seconds. Okay? And then you'd repeat that on this side and so on and so forth. If you had other areas to treat, you could then work on those, then come back and repeat that whole palaver again a second time in here, because there's layers in here. You won't get it all the first time around. The other option is the side-lying stretch for that area. So Mike, go ahead, lie on your right side. And this one, some people this works much better. Some people are so tight you can't get the leg high enough to even get your knee underneath. So some people you'll be down here to begin with. Okay, but we're still trying to get a stretch in the same area. Go ahead, take a big breath in. Hold, push the leg down hard towards the floor. Good, hold. 1, 2, 3, 4. Relax. And then you just bring it up. And then you hold still, go again, big breath in. And push down real hard. 1, 2, 3, 4. Relax. Gently pull it up. Some people, if it's not stretching, you'll have to do a traction this way as you bring the hip up each time. And then once you're high enough to make it a lot easier on you, you can stack their leg on your thigh. Again, you'd want to do at least 3 post-isometric releases, and after the last one, have a hold of at least 20 to 30 seconds. Be prepared to do both of those stretches on any one individual, because one will often work way better than the other, and there's no pattern to it. You've got to try both on each person you're treating and use the one that produces the best stretch in the correct location. Okay, that's it.